name is Margaret Wang. Welcome to Mental Health and Margaret. Today we have Kao Se Chow, licensed clinical social worker from AKI, Asian Americans for Community Involvement, the largest and oldest mental health institution serving the Asian American population in the South Bay area. So thank you so much, Kao, for coming today. Today we're going to talk about some relevant issues related to children and adolescents and mental health. So, Kao, tell us a little bit about self-esteem and how it is affected by cyberbullying and bullying today.
Well, before I even get into that, I just want to say thank you, Margaret, for giving me the opportunity to be on this show today. It's a pleasure to be here to talk about this issue. First off, I actually want to talk a little bit about the differences between bullying and cyberbullying, as some of the viewers may not be familiar with cyberbullying. Cyberbullying is very commonplace nowadays because of the evolution of the digital age. And so with the evolution of technology, such as cell phones, tablets, computers, the internet, and also social networking, things have changed in terms of how we communicate or how we interact with each other. And that also includes how people are bullied. Now, compared to in the past with traditional bullying without the technology in the digital age, as I recall when I was younger, when I was in the 6th grade, in middle school, I was about 5 foot tall, so I was maybe about this tall. and there was an area that a lot of the students had to go through to get to the lunch line, and the lunch line used to get really, really long. And so a lot of the students would have to run or walk really fast to get to that lunch line, so then they didn't have to wait in line so long. So what would happen is the students would walk through this hallway, but this hallway was flooded with 8th graders, and they were big. I mean, we were just like 5'2", 5'1", and these 8th graders like 5'5", 5'7", 5'8", 6 foot tall, whatever. And so what would happen is they shove us. So when we walked through the hallway, or if we'd run, or if we walked even fast, they'd just push us into the lockers. And so that was my experience with bullying, you know, just being physically intimidated and pushed around by someone that was just scary, big and scary to me. Nowadays, bullying with the technology and the digital age is a lot more intense and intimate. And the reason I say that is because when you're at school, you're bullied at school in that moment and at that time. And generally when you come home, it's over, right? You're in the confines of your home, in the safety of your parents, siblings, and whatnot. But with technology, it's 24/7. You know, you have your cell phone at school, you bring it home, or you're bullied at school and you come home and you have your cell phone with you, and you go on your laptop and you go to Facebook and you check your email and you go to your instant messaging application, whatever it is that you're using, and then you get all these messages, flooded with messages that could be very negative, like, you know, you're ugly, you're this, you're that. And just imagine experiencing that in person in school, but also when you're going home and you're on your social media sites, because nowadays youth are more connected to the media through technology, because that's just the way it is now. You know, people don't just make phone calls anymore. A lot of texting and instant messaging. So, you know, you're flooded with those messages. You know, so it's happening all the time throughout the day. So I think that's one kind of difference between traditional bullying and the digital age and cyberbullying.
So because technology is so accessible, teenagers are much more likely to be cyberbullied. And so what can parents do to intervene in such cases?
Well, I think some of the effects could be very detrimental in regards to bullying and cyberbullying. I think, as you mentioned before in the previous question, low self-esteem. If you're constantly being bombarded with negative messages or images of yourself, then your self-esteem is definitely going to be down. Secondly, there's some research that supports that with folks that are being cyberbullied, they could be at higher risk for self-harm and suicide. And in the past, there have been a lot of media coverage on kids and youth that unfortunately have taken their lives because of being bullied. They just had nowhere else to go. They felt very isolated and and the bullying was so intense that they had to take their own lives, which is very sad. And thirdly, symptoms associated with PTSD or post-traumatic stress disorder could evolve through bullying, in that kids become so afraid of the bully, the perpetrator, that they don't want to go to school, for example. They fear school now because if they go to school, they'll be confronted with this person. So those are some of the negative effects of cyberbullying and the emotions of the youth and child. Now, what parents can do, I think, to kind of help with this is to educate themselves, firstly, on technology, on what their kids are using. I think sometimes parents kind of buy things for kids, like new cell phones, and they don't even know how to use them, right? And so making sure you're aware of the technology you're giving your child, because with that technology, they can access so many things. Secondly, also just communicating with your child, having a conversation with your child, just checking in with them regularly, seeing how they're doing with school, with friends, with life. I know nowadays folks are very busy with work. Parents sometimes don't have the time, but just making that time, maybe. A lot of people nowadays are trying to do a power outage hour, perhaps, where they disconnect all electronic devices and they kind of sit down and have dinner, and they have just a normal conversation, kind of check in and see how things are going and how they're doing. And then if you do start noticing things, red flags could be kids can be more isolated, more disengaged in activities that they were interested in, locked in their room all the time and not really engaging in social activities. Those kind of behaviors may be red flags for parents to kind of go, well, maybe I should really check in with my son or daughter and see what's going on.
Okay, so encouraging communication with your parents and your children is really important in informing these strong relationships, so that people avoid these difficult situations and manage them better.
Definitely, communication is always a very powerful tool that helps to build that relationship with your child. And also just, I think people get the misconception that, well, I don't want to be a helicopter parent and kind of, circle my child all the time when they're on their cell phone or laptop or computer. And it's not about that. It's just more about just having that open conversation, that open relationship with your child, just saying, hey, how are you doing? How are things going? What's been up with you lately? Oh, you're doing this now on this website or on this cell phone, and just checking in with them on a regular basis, yeah.
Okay. So on to our next topic. Divorce is one of those things that affects both parents and children emotionally, and it's a very difficult time. How do children and adolescents express their behavior differently during this period of divorce?
Well, as you know, divorce is a very difficult time for individuals, especially for children and for adolescents. I think that children and adolescents display the negative effects of divorces differently. For example, adolescents, they're in that developmental stage where they're more independent, they're more willing to speak up for themselves or advocate for themselves, and also just more rebellious. And so what happens is a lot of times in divorce situations, an adolescent may start acting out, breaking rules at home, maybe like breaking the curfew rules, sometimes telling one parent one thing and the other parent something else, so kind of splitting the parents. Also just academic performance issues at school could be affected, as well as behavioral issues at school, maybe just acting out more at school. I think with adolescents, they tend to have this connection with their friends and their communities more, so they feel like, well, if my parents are getting divorced, it looks bad on me, right? Mm-hmm. So they act out because of that. They feel like it's something that's negative to them, and then it's a lot of stigma towards that too, and then that their friends may judge them a certain way, so they kind of are usually not very happy when a divorce occurs. Now, with children, on the other hand, children kind of display it a little differently. On the opposite end, they tend to be more clingy towards the parent, more dependent. They're more sad, generally, and also sometimes they become isolated and lose interest in things that they normally was interested in doing, but now, due to the divorce, they may not be interested because they're so sad. Mm-hmm. So those are kind of the two different kind of red flags or signs that kind of show, like, that adolescents show and that children show when it comes to divorce.
So with these red flags in mind, what can parents do to approach the divorce? How can they communicate more openly?
Well, definitely, just like we mentioned before with the cyberbullying issue, just being more open to communication, being honest with the child and the youth about what's going on. I think another thing is also just modeling appropriate communication and effective parenting, and just continuous care for the child. I think that sometimes children may feel like, once our parents are divorced, they're not going to care about me anymore. Well, that's, I think that's a misconception, and that's not the case. The parents should definitely continue to support the child, whether it's, together or individually, and also just model appropriate communication so that the kids will also learn, well, even though mom and dad aren't together, I can see that they still have a very positive relationship, right? Because in life, Johnny and Mary are together, they break up, right? They're boyfriend, girlfriend, they break up, and they go their separate ways. But, in life that happens, breakup, it's normal. It's a normal part of life. And so kids can see, like, well, my parents are getting divorced, they're breaking up. But at the same time, they're now moving on to a more happier relationships with their new partners, and that things can work out that way as well.
So modeling this behavior is really important for children to see how relationships can work out.
Yeah, and also just being on the same page in terms of support of the child, making sure that both parents are communicating and setting, like, the ground rules that are explicit to the child, and that they're both following through on it. It's definitely very important.
So as for our last topic, seeking therapy can be quite overwhelming and anxiety-provoking for people, as you know,
Definitely.
of many different ages. What is it like working with adolescents who may be resistant or hesitant towards seeking therapy because they may be perceived as having problems?
Well, definitely resistant teens are challenging from my experience in working with adolescents and in therapy. But it's also, I think, for a lot of clinicians, it's challenging, but it also provides a lot of opportunity for us to kind of to demystify or destigmatize mental health. I think teens come in with this idea that, mental health is for people that are crazy, and I'm not crazy. I'm just having some problems here, or I'm not having any problems at all. I'm doing just fine in school, even though maybe their grades are really poor and they're having behavioral issues. But I think one thing that is helpful is to kind of roll with the resistance and go, okay, well, I understand, that you may feel like counseling isn't the thing for you right now, but exploring with them what else is going on in their lives is definitely a factor. Kind of hearing their voice, because a lot of times, sometimes the youth feels like the parents are overwhelming and maybe scapegoating them for being the problem, but in a sense, the child doesn't see that as them being the problem, or the youth doesn't see them as being the problem. And so kind of exploring with them what are the kind of the issues that are affecting them, and working collaboratively with them in terms of treatment and how we want to approach service planning with the youth. One of my supervisors once said to me that, and I use this analogy all the time with youth, and I think it's very helpful, is that in therapy, it's like the client or the youth is a vehicle or as a person, and I'm the vehicle as a clinician. And I only can take you to where you want to go. So as the driver, you kind of decide where you want to go, but I'm the vehicle that helps you get there. So kind of giving them that analogy kind of helps them understand, okay, well, he's not trying to correct all my problems. He's just trying to help me get to where I want to go. And so just working with them collaboratively, focusing a lot on their strengths. I think youth a lot of times have a lot of strengths that aren't recognized, and kind of focusing on that and kind of broadening those strengths versus focusing on the problem. Recognizing the problem is important, but also focusing on the strengths to help them to resolve the problem is kind of, I think, a good approach to work with folks that are resistant to therapy.
So it sounds like meeting the adolescent where they are and kind of working on their strengths really helps them move toward change.
Right. And by working on their strengths, you can kind of see more of a progression versus kind of going backwards and working on their issues specifically. And also, it doesn't make the youth feel well, right? They feel like, oh, I'm the problem, or I have all the issues. So working on the strengths and kind of working on these incremental goals, small goals, but incremental goals that eventually lead to something bigger, I think is very important.
So talk a little bit about this change process and how you can go about setting these small goals along the way.
Well, I think the change process is, it varies for different people, and there's various levels of it. But in the very beginning, as a therapist, you want to build as much rapport with the youth as possible. So getting to know them a little bit, get to know where they're coming from and where they want to go, and then planning that out in small increments, small steps. And then, maybe Johnny wants to get better grades in math. So, okay, what are some ways we can work around getting that done, And then kind of eliciting also the support of him. Not just like, I'm going to be the therapist or I'm going to be the doctor and I'm going to fix you. It's like, well, let's work together. Let's try to problem solve together to see how we can get to you getting better grades in math. Does it involve your parents? Does it involve your teacher? Does it involve your siblings? Does it involve other people? What do you think, Johnny? So I think that kind of mindset of collaborating and working on the strengths of the youth really is important in building these small steps.
So it sounds like it's really important to kind of affirm the individual strengths and also kind of point out the specific things that might be the supposed barriers. So tell me a little bit about that.
Well, as working with the youth, there are a lot of barriers in working with the youth. And we talked a little bit about the stigma sometimes and also just being resistant to it. But I think that when you work with the youth and you also involve the parents and kind of get their buy-in as well, I think that's actually really an integral part of that as well in terms of the treatment of the client and the success of the service that you want to provide with them. Because when you're only in therapy with the youth maybe for an hour, once a week perhaps. While the rest of the time, the youth is at school, at home, out in the community. So you want to foster outside relationships to kind of build or to work with you in therapy to kind of help with the youth. So I think you can't just be one person working with the youth. You have to have or elicit support of others so that you can continue to have growth outside of therapy as well. Because one day the youth will end therapy and life will go on, right?
So it sounds like you kind of focus on the outside relationships as well as the one-on-one relationship.
Definitely. I think that's definitely a big part of helping out a youth is the one-on-one and then, if necessary, the outside support.
What is the best way to work with the parents as well as the teenager in this process?
Well, I think it's important to kind of hear, all opinions and all sides of the story. I think a lot of times parents will come in, from my experience, and they'll just kind of say, Johnny's the problem and scapegoat Johnny for things. But also you want to let Johnny have a voice and also share what's going on in his life, because maybe there's something going on, excuse me, that the parents aren't aware of. And so in a therapy setting is usually a safe environment for Johnny to kind of open up and share things with his parents and kind of let them know what's going on with his life. And I think in that way, when you have that type of open communication and that type of honesty in that setting, it really can show that there's a lot of work that could be done and that there's a lot of progress that can be made as well.
So it sounds like the adolescent's voice is really important in forging this change.
Definitely. I mean, the youth having a voice is something that's going to be important. Like I said, I mean, you're only going to be seeing the youth in therapy for so long. After that, they will have to move on in life and learn to be more independent and advocate for themselves or communicate for themselves in various means and ways.
So we've talked a lot about teenagers and reaching change for them. What is it like working with children who might be reluctant toward therapy?
Well, children are very very sensitive and challenging population as well. They tend to be, in terms of communication styles, they tend to be very different, right? I mean, I can sit down and have a